Here are some frequently asked questions about living organ donation. What functions do the kidneys perform? The basic functions of the kidneys are to filter poisons out of your blood and to regulate water balance. The University of Michigan performs approximately 200 to 250 kidney transplants each year. In calendar year 2009, 209 kidney transplants were performed, of which 98 were from living donors. What are the risks of donating my kidney? The complication rate for donating a kidney is around 6%. As with any abdominal operation, there is risk for complications. The majority of these complications are minor. If there are more serious complications, they can usually be treated and rarely have any long-term effects. The complications include, but are not limited to, wound infections, urinary tract infections, pneumonia, blood clots, pulmonary embolus or a clot in the lung, injury to the abdominal structures, large intestine, spleen, or pancreas, and death. The chance of dying from a complication of the donor operation is 1 in 3,000. When will I be able to eat again? Patients generally start with clear liquids as tolerated, and their diet is advanced accordingly. How long will I be in the hospital? The length of the hospitalization varies by individual, but most donors are generally in the hospital from 1 to 2 days. How will this be paid for? Living donors are not responsible for the cost of their donation workup, hospitalization, or the costs of complications. These services are covered by the Transplant Center. If a donor receives a bill for these services, they should contact the kidney financial specialist at area code 734-936-7779. Donors will be responsible for their lost wages, cost of travel to and from the hospital for pre-transplant, admission, and post-transplant procedures. Most medical insurers do not reimburse for these items. The National Living Donor Assistance Program may help with travel expenses for patients who qualify based on financial need. The Transplant Donor Coordinator can provide information on this program. You will need to complete paperwork and provide financial statements, as well as the recipient, to assess the financial need for funds. It takes approximately 4 weeks to apply for funds, receive approval, and receive a card for travel funds. These funds can be used for travel to the Transplant Center for the donor evaluation appointment for yourself and one additional person. The funds can also be used for travel for yourself and another person for the transplant surgery. If you plan to apply for and use these funds, it will be necessary to plan ahead of your evaluation appointment. When can I return to work? You should anticipate being out of work for 4 to 8 weeks after your surgery to give your body time to continue healing itself properly. In some cases, donors may be able to return to non-active work sooner. Your return to work release date will be dependent upon the type of work you do. You may not drive for 3 weeks or while on narcotic pain medications. You will not be able to lift anything greater than 10 pounds for 6 weeks to prevent abdominal herniation. With the exception of walking, you should avoid physical exercise, exertion, and contact sports for approximately 6 weeks after your surgery. How much does it hurt? Although pain tolerance varies by individual, all individuals should anticipate some pain in the days following surgery. Once the pain medication that was given to you for the operation begins to wear off, you may have some pain and discomfort. Pain medication will be given to alleviate or minimize your discomfort as much as possible. In most cases, you will have control over the pain medication through a machine that allows you to push a button and get a dose of pain medication right after the operation. What will the scar be like? With a laparoscopic nephrectomy, you will have several small scars. One 2 to 4 inch scar will be near your belly button or pelvic area, with several other 1-inch scars on your side. Scars will fade with time. Using a scar revision cream after the initial healing can be helpful in minimizing scarring. Is a living donor transplant better than a transplant from a deceased person? Yes. A living donor transplant is almost always better than a transplant from a deceased person because the anticipated graft survival is longer and the transplant is planned. Are there any long-term physical restrictions or other limitations? There are no restrictions or limitations on physical activity once you have recovered from the surgery. However, kidney donors should avoid taking nonsteroidal anti-inflammatory medications because the risk of injury to the remaining kidney from these medications is high. I am a woman and I want to have children. Will donating prevent me from getting pregnant or having a healthy baby? Living donation is not a reason to avoid future pregnancies. We recommend that you inform your physician that you have donated a kidney and are considering becoming pregnant. This concludes our presentation on living kidney donation. If you have any questions, please contact us at the phone numbers listed on screen. Thank you for considering living kidney donation at the University of Michigan Transplant Center.